Hey guys, welcome to the channel. This is a clinical skill video for healthcare students, future midwives, and new nurses, any other allied health professional that wants to learn the correct technique for measuring fundal height. That is one of the most important assessments that you are going to do as part of your antenatal care. And if you want to watch more videos like this, please consider subscribing to be notified when I upload new videos. Let's start. So fundal height refers to the distance between the pubic symphysis and the top of the uterus known as the fundus. So here you can see this diagram showing exactly where the pubic symphysis is, and then you go up to the top of the uterus, and that is where you measure from. So basically after 20 weeks of gestation and whenever there is a concern regarding fetal growth, the frequency of measurement is once a month until 36 weeks of gestation, and then it becomes twice a week until term. If the bladder is full, the kidneys will push down on the uterus, causing it to sit lower than usual. So you always need to ensure that the bladder is empty before taking the measurement, and this is how you know that the bladder is empty. So once you've taken the measurement, you record it on the antenatal card or in the notes, and you also need to plot the graph. Ensure that the patient is positioned consistently, that the bladder is empty, and that the measurement is taken at the same time each time. If the measurement is small for dates, refer the patient urgently. So you take the fundal height in centimeters and you plot it on the vertical axis, and the gestation in weeks is on the horizontal axis. I hope you enjoyed this video and learned something new. If you did, please remember to share and leave a comment. Thank you very much. You can get the graph from the World Health Organization website. So once you've plotted the fundal height onto the graph, you compare it with the expected weight centiles. If the fundal height is below the 10th centile, then it's considered small for dates. And if it's above the 90th centile, then it's considered big for dates. You ask the patient if they've been for a wee, and if they haven't, you ask them to go for a wee before coming back to measure the fundal height. So small fundal height can be caused by various factors. Intrauterine growth restriction is one cause. That's where the baby is not growing at the rate expected for their gestational age. This can be caused by various factors such as chronic hypertension in the mother, chronic ill health in the mother, smoking or alcohol misuse during pregnancy, pre-pregnancy malnutrition, or even chromosomal abnormalities in the fetus. Premature rupture of membranes is another cause. That's where the water bag, the amniotic bag, has ruptured prematurely before the onset of labor. And that would result in loss of amniotic fluid, leading to a smaller fundal height measurement. Amniotic fluid, oligohydramnios, is another reason. Amniotic fluid is essential for fetal development and its volume is closely monitored during pregnancy. Reduced levels of amniotic fluid can impact fetal growth and development. Other causes include placental insufficiency, where the placenta is not functioning effectively. Fetal anomalies and multiple pregnancy are other causes to consider. It's easy to do, but if not done correctly, you can get an inaccurate reading which could lead to potential problems. So make sure that you wash your hands and put on a clean pair of gloves. You need to ensure patient privacy by draping the patient appropriately. So the patient needs to be in a semi-reclined position, which means lying on their back with their top half of their body supported by pillows. And then you need to explain the procedure to the patient and get consent. Now, the purpose of measuring fundal height is to monitor fetal growth. By comparing the fundal height with the standard growth chart, we can estimate the amount of amniotic fluid around the baby and also detect any growth restriction early. Make sure that you use a measuring tape that is not elastic, otherwise you won't get an accurate reading. So the first thing you need to do is place the 0 mark at the top of the pubic symphysis. You do this by asking the patient to slightly lift their legs up so you can identify the top of the pubic symphysis, and then you place the 0 mark at the top of the pubic symphysis. Once you've done this, you gently stretch the tape across the curve of the abdomen to the fundus, the top of the uterus. Make sure you don't pull the tape tight because this will distort the measurement. That means when the patient is at their midstream voiding, just after they've had a wee, or when the bladder is empty. This will give you a standardized measurement each time. The accuracy of the fundal height measurement can also help us to assess the gestational age of the fetus and confirm the estimated date of delivery. It also helps us to detect multiple pregnancies because the uterus tends to be bigger than single pregnancies at the same gestational age. So today I'm going to teach you how to do it properly. So first of all, we need to establish what actually is fundal height. And it is usually done after 20 weeks of gestation because the uterus has become big enough now that you can actually accurately measure from the pubic symphysis to the top of the uterus. It's really important to note that this assessment is only done once a month, but you will be doing it routinely at every single antenatal clinic. Attendance to see that it is on the correct centile. However, there might be certain times in the pregnancy where we might need to measure the fundal height more frequently. And one bonus tip or an important thing to remember is gestation age is equals fundal height in centimeter. Well, thank you so much for watching.